Our second, third place winner is General Prognostics, and this award is coming from Johnson and Johnson, Mintz, Argenta Advisors, and M2D2. And just like our other third place finisher, they'll be receiving $25,000 in in-kind services. And I think, Sean, are you speaking for the team tonight?
Yes, yes.
Great. We'll let you get the screen up and you can take it away.
Can everybody see my screen here?
It is on its way. We don't see it yet, but it says it's starting to share. All right. You just put it in presentation mode. I think we'll be good.
Yep. It's coming up. Good. Okay. Well, thank you so much. I really appreciate the opportunity to present, and I'm really flattered. On behalf of General Prognostics, my name is Sean Matsuoka, and I'm the co-founder of General Prognostic. In short, we call it GPX, where we make bloodless blood tests. First of all, let me explain to you the problem that the patients of pulmonary arterial hypertension are facing. The characteristics are as such. Women are disproportionately affected by this disease. 80% of the patients are women, and over 60% of the patients are diagnosed at a very young age of 50 years or under. And lastly, unfortunately, over 50% of the patients die within 5 years of diagnosis. Why is this happening? It's twofold. One is there's no proper way to monitor the patients, and hence the patients are oftentimes under-medicated. So in a recent publication shows that between 40 to 60% of the patients die before receiving proper treatment. And without proper treatment, the patient just cycle down. So and puts a lot of burden and cost in the health systems. So the name of the game is patient need better monitoring to get optimal therapy and avoid hospital. Let me explain to you the current method of PAH monitoring that is still unmet. The needs are unmet. Most often, when patients are discharged from the hospital, they're asked to, do a symptom monitoring. As you can imagine, it's very low in predictive power, and it just doesn't meet the need. On the other hand, the cardiac pressure monitoring are considered the golden standard. However, they're invasive and they're very expensive. What's becoming more popular these days are the non-invasive biomarkers like the Apple Watch or the AliveCor. There are two problems with this. One is it has a very high false positive rates, and then the other is that it's very hard for the clinician to interpret the data. So what we do at GPX is we're introducing the first physician-prescribed PAH remote monitoring service. So upon discharge, patients are given a smartwatch wearable. We're also providing an app that can identify the vocal biomarker and a weight scale. Our algorithm scans throughout the day on these digital biomarkers and the vocal biomarkers and identify any significant trend that is occurring, and combine that with a confirmatory blood test. So the patient, upon identification of a significant trend, are asked to do a finger prick drug test, blood draw, and send it to our affiliated lab. Within 24 to 36 hours, the results are returned, and if it confirms that the significant trends are happening, then we ask the patient a patient and the physician to do a medical intervention. What becomes interesting is as we can repeat this cycle, we can soon remove the confirmatory blood test and become completely digital, hence achieving the bloodless blood test. Our go-to-market strategy is such. Our moat, in terms of our IP, we're keeping our algorithm a trade secret. We are filing a provisional patent on when to do a blood test. We are building a publication wall. So we have 7 pilot sites that are in progress right now, and we will be publishing the experience from the hospitals. Lastly, my co-founder, Javier Echenique, has significant industry connections. We are connected with 30 of the 400 heart failure centers. In terms of a regulatory strategy, our existing algorithm is considered a Class 1 MDDS, so it requires no FDA clearance. However, as we move to the bloodless blood test, we will be applying for the 510(k) clearance. Lastly, in terms of the business model, we are a B2B subscription model, and we charge the hospital $2,000 per patient per year. In turn, the hospital can apply for reimbursement of over $2,000 per patient per year. So in executive summary, the blood test biomarkers are the most relied on for PAH patients. The version 1 is ready and it's launching. The market need, customer willingness to pay, the reimbursement has been validated. The M2D2 resources will fund the PAH prediction engine development and validation via retrospective and prospective clinical study. Lastly, on the team, the team comprised of well-experienced and networked individuals in the cardiac rhythm space, as well as blood test and AI and hospital delivery. Thank you so much.